Decidua. It is decidua. Nurses. For nurses here. Nurses. Nurses. What is decidua? Part of the endometrium. Then decidua is a specific name for the endometrium during pregnancy. Okay, decidua. What is endometriosis? So endometriosis comes from the word endometrium. So endometriosis, meaning CIS, there is a condition wherein, a pathologic condition wherein there is what? Again? Fibrosis? Endometriosis. So there is something wrong with the endometrium. It is a condition wherein there are endometrial implants outside of the uterine cavity. So it is found in ectopic sites outside. Okay? That is endometriosis. And it usually presents with dysmenorrhea. Okay, so you have there three regions, the decidua basalis, capsularis, and parietalis. Okay, so let's now take up the vagina, which is a fibromuscular tube extending from the cervix to the external genitalia. Take note that the walls of the vagina lack glands, therefore, it derives its secretion or lubrication from the cervical glands and also the vestibular glands. So the mucosa of the vagina is a thick, stratified, squamous, non-keratinized epithelium rich in glycogen. Okay. So the glycogen there is used by the bacterial flora to produce lactic acid. And lactic acid, so therefore there is a low pH there during follicular phase and it inhibits invasion by pathogens. And then you have the muscularis layer, which is made up of smooth muscles and adventitia. So let's now take up the external genitalia. Okay, by the way, what is myoma or fibroids? Or fibrosis? Myoma or fibroid. It's a tumor. A tumor. What? A tumor with myoma. Myoma. So it comes from the muscle, muscular. Okay? And then where? In what organ? The uterus. So that it is a benign. Okay, benign tumor from the muscular layer of the uterus, myoma. So you will encounter those terms in your OB/GYN. Okay, so external genitalia, you have now the labia majora, which are composed of two folds of skin with a core of subcutaneous fat and thin layer of muscle in their walls. So the inner aspects are devoid of hair, the external surface contains hair. Both surface contains sweat glands and sebaceous glands. And then the labia minora, it is composed of two smaller folds of skin devoid of hair follicles and adipose tissue, but contain numerous sebaceous and sweat glands. And it has a core of spongy or erectile connective tissue covered by stratified squamous epithelium. And then you have now the vestibule between the two labia minora, covered by stratified squamous epithelium. And it contains two types of glands, the Bartholin's glands and minor vestibular glands. And then you have the clitoris. This is a small cylindrical erectile bodies which terminate in the prepuce covered glands clitoridis, and this is covered by stratified squamous epithelium. And it contains many sensory nerve fibers and specialized nerve endings like Meissner's and Pacinian corpuscles. So what is now the modality of your Meissner's corpuscle and Pacinian corpuscle? Modality. Yeah? For Meissner's. Pressure. Meissner's. What about your Pacinian? Vibration. Have you seen your Meissner's and Pacinian? Yes. And then the mammary glands. So mammary glands are not part of the female reproductive system. However, they undergo cyclic changes in relation to the menstrual cycle and pregnancy, and also in response to the different hormones. So these are accessory glands of the skin specialized to secrete milk, and it is composed of compound tubulo-alveolar glands made up of 15 to 25 lobes separated by adipose tissue and bands of dense connective tissue. So the pre-pubertal mammary gland is not functional. Okay? And then you have the resting adult mammary gland, non-functional. Non-functional pa. And then the resting adult mammary gland, alveoli are not developed. So what are these alveoli? What organ did you encounter having alveoli? Lungs. Okay, so there are also alveoli in the mammary glands. And what are these alveoli with respect to the mammary gland? Here are the secretory units of the mammary glands, so milk secreting units. So pregnant adult mammary gland, here there is now proliferation of ducts and growth of alveoli, thereby enlarging the breasts. Okay? And then during the third trimester of pregnancy, there is an increase in the number of plasma cells having secretory IgA and IgG. What is now the role of IgA and IgG in immunity? What? And then lactating adult mammary gland. So this is now the active mammary gland. So major histologic change, there's accumulation of milk and alveolar lumens and their subsequent dilation. Okay, so the secretions of alveolar cells, you have lipids and proteins. Okay, so with respect to milk injection reflex, the substance responsible is oxytocin. While production of milk, what is responsible? Prolactin. Okay. The secretions of mammary glands, you have during the first 2 days after birth, it is known as colostrum. So it contains antibodies. Okay? So let's now take up the clinical considerations. Some clinical considerations affecting the reproductive system, female reproductive system. So in vitro fertilization, this is a procedure used for patients with tubal disease, endometriosis, oligospermia, sperm antibodies, and unexplained infertility who wants to become pregnant. Okay? So it involves ovarian hyperstimulation, oocyte retrieval, fertilization, embryo culture, and embryo transfer. Okay, and then you have cervical cancer. This is the third most common gynecologic cancer, and this is strongly associated with human papillomavirus infection. Okay? So it originates from the stratified squamous, non-keratinized epithelial cells. Okay, so human papillomavirus infection. So there is now a recommendation for vaccination of females and males. Okay? Females and males. So for females, this is again cervical cancer and genital warts. For males, This is against genital warts. So recommended age is 13 years old to 26 years old for females, 13 years old to 29 years old for males. Okay? That is a recommended range. It may be as early as 9 years old. Okay? Because there is a study wherein teenagers less than 13 years of age undergo or has sexual intercourse. Okay? Below 13 years of age. So it is recommended as early as 9 years of age. The vaccination against cervical cancer. So this cervical cancer is also associated with multiple sexual partners. Okay? So screening test by pap smears. And then ovarian cancer. So this is the second most common gynecologic malignancy and the deadliest. Risk factors, we have high dietary fat intake, history of nulliparity, infertility, late childbearing, and delayed menopause. So 75% of cases, the type of cancer is serous cyst adenocarcinoma. Okay. So 75% of cases present with advanced stage of the disease at the time of diagnosis. And then endometrial cancer, which is the most common gynecologic malignancy occurring in postmenopausal women. Okay, so adenocarcinoma accounts for 80% of cases of endometrial cancer. So, most common symptom is uterine bleeding. Then you have breast cancer. Risk factors, mainly family history of breast cancer in a first-degree relative, early menarche. 80% are discovered as lumps by patients. So, screening includes breast examination, self-breast examination, regular, okay? Regular breast examination, then you have mammography and ultrasonography. So for women, 40 years old or 30, recommended there is 30 years old and until 60 or 55 years old, you have to have mammography. Okay? And ectopic pregnancy. This is implantation occurring outside the endometrium, that is maybe in the cervix, oviduct, ovary, abdominal, or pelvic cavity. So the most common site is the oviduct, particularly in the ampulla. Okay? Then the placenta previa, which is implantation of the placenta over or near the internal os of the cervix. What is the most common site for implantation? The normal implantation site. Normal implantation. This is a normal implantation. Placenta previa. Normally, the placenta implants where? Normal. In the what part? What part of the uterus? Upper posterior. Okay? So if it implants near the internal os of the cervix, meaning near the opening, it is known as placenta previa. So, word of caution, vaginal exam is contraindicated in total or partial placenta previa because it precipitates profuse hemorrhage or bleeding. So no internal examination if you suspect placenta previa. Okay? Okay, so this will serve as your demo. So this is the slides here